Hi, my name is Lisa Pearson and I am a Trust-wide Suicide Prevention Lead at Northamptonshire Healthcare Foundation Trust. Thanks for tuning in and listening. These are a set of recordings called Let's Talk About Suicide. At the very beginning, I just wanted to give a warning that actually we talk and use the word suicide throughout these recordings. This may not be the right time for you to listen to these, so please think about your well-being. And if it's appropriate, please switch off and come back at a later date. Just make sure that you're feeling okay to listen to the content.
Welcome and thank you for listening today. We're going to be talking and introducing some of the things that we've got planned for World Suicide Prevention Day, and I have a guest with me. Could you introduce yourself?
Hi, my name's Anne Rackham. I'm Chief Operating Officer at NHFT, and I'm also the Senior Responsible Officer for the Mental Health, Learning Disabilities and Autism Collaborative.
Oh, thanks so much for being here, Anne. So on all of the recordings we've been doing, we've been asking a question around suicide, and we've been asking, why do you think it's so important to talk about suicide?
It's important on so many levels. So I'll reflect first on a professional level. So I've been a mental health nurse for many years. I have, in that time, worked with many patients and have sadly lost some patients to suicide. And you get that first-hand witness of the distress that causes, the impact that has on families, on communities and staff teams. And that really led me in the early years to start to link up to some of the suicide prevention work of how do we sort of beat this? We've got so much health education out there about lots of other illnesses, but this was never really very much publicised in the old days. We didn't hear about it. It was just something that was distressing, but not necessarily out there in public health. And I got involved in the very early days in some of the suicide prevention work about how we develop our communities, because it's not just about mental health services. It's about the people we live alongside. It's about our families. It's about the people we work with. So I was really excited to get involved in that work. And what's exciting this year is we're doing a real refresh within NHFT and also within the county on the work that we've done. How do we make sure we progress this agenda and make sure that we're talking about the really important aspects for people? So that's where I came from professionally. From a personal level, I've also lost someone to suicide. That my life's been touched by that too, as so many people's have. And I would expect that if you asked our staff group, our communities, so many people would say that somehow they had been touched by suicide, and yet we don't talk about it. We don't have that open conversation the way we might about other conditions or ways of dying. And I think for me, on both levels, it's really important that we look after each other by talking. And we know that talking about suicide is really important, and the myth is that it will make someone worse. It could make someone have the idea of suicide, and that's just not the truth. The truth is, by talking about these subjects, that it's hard at times, gets you an emotional connection on whatever level, and we must just keep that narrative going. So I think it's a really exciting year for pushing this forward.
Oh, thank you, Anne. And World Suicide Prevention Day is the 10th of September. It happens every year. It's sponsored by the International Suicide Prevention Alliance. And this year we have a new theme, and the theme is called Change the Narrative. And I think we've really read that as this conversational importance of talking about it, using the word, but also giving our staff, the right language through lots of different avenues, upskilling and just giving them the confidence to be able to talk about this subject matter, which I think is going to be so important for the coming year. So we can really show that for us within NHT, we are trying to change the narrative on this subject.
And I think we've really got into the topic to realise that it's not just about what services our mental health services provide, but actually how do we live as a community staff group? How do we live in Northamptonshire population? It's much wider than what we are. It's about how we connect in, and we're in a prime position to be sharing the importance of talking. If we can get it right in how we live with each other in NHFT, that will help our wider community as well. And that's quite exciting in such a sad subject. But there is moments when you can see those benefits. So for you, Lisa, what are you planning for the week next week? What's happening?
So we've got lots of things available. So we are relaunching our Trust Self-Harm and Suicide Prevention Strategy Group on the 10th on World Suicide Prevention Day at the University of Northampton. And we'll actually be having some messaging on their large screen that they have on the tower around World Suicide Prevention Day, which is great. We thought it was really important to acknowledge some of the change and the work that's already gone on. And I think that having a group that can have that governance looking at it and acknowledging actually that everybody, all staff are involved in suicide prevention at some level. And I think showing what we're doing, sharing that good practice is really important. And I think as being like a trust-wide lead for suicide prevention is that it's not necessarily about me doing all of the work. Actually, there's great work going on already. It's about me being able to support that work, and having a trust-wide group means we can bring that all together. We can also then look at, we're going to have a lived experience group. We've got Andy Willis, who's our lived experience lead, who works really closely with me. And we are looking at where there's opportunities for co-produced work, because we absolutely know that the benefit of moving forward and making changes and really thinking about what our community needs is by asking our community what they need. So that's really exciting. And we're looking at how we can have ambassadors, people that really stand up for this area and keep that conversation going from a narrative point of view, but also within the staff teams. And I think your point is really excellent, that part of that group is also looking at what staff support there is there, because this does touch everybody, and it's so important that we recognise that we are part of that community. Even though we are a member of staff, does not mean that we're immune to that having those feelings or thoughts, or having a family member or somebody in their friendship group. So I suppose it's that empowering by having that trust-wide group means that we can show what we're doing well, but also look at perhaps where our gaps are. We're also recorded 5 recordings on different subjects, and what we've trying to do, I think, is really get some messaging out to our staff team to give them the confidence to talk about this subject matter, but also to tackle some myths, to talk about bereavement. And I think that is so important, and they will be released next week in the celebration of World Suicide Prevention Day, but also thinking about giving people, the power and the communication skills and not being afraid of the subject. Which I think is so important. Suicide is a powerful word, but when you use it, that's the power in it, not necessarily not using it. So we're going to be releasing them next week, and then the week after we're actually providing quite a lot of co-produced and co-delivered training, myself and Andy Willis do, to staff teams. So we've got we're training the whole of talking therapists, for example. We've got some HR colleagues. We're really again trying to just upskill and give people the opportunity to come and listen and come and actually see contextually what's happening, but actually give people hope and power that they can talk to their friends and family, and they can talk to their communities, and they can talk to their colleagues, which again is so important. So there's lots of exciting work going on, and again, it always feels strange saying exciting or enthusiasm around such a sad subject matter, and we must still remember that even one loss is too many. But within the scheme of it, what we're trying to do is just give people that hope that they can make a difference, which I think is really important.
And I think that whole element of hope is something that's on a personal level. It's also on a team and a workforce level and a community network level, that I think years ago there was no hope in this subject. It was something that was not spoken about and really feared, and yes, absolutely the outcome can be terrible, but if we can make a difference to give hope to people, how much further are we going to go to prevent further loss? And that's the bit we have to focus on. And I think the hope aspect of that really comes through in some of that co-production. And I think now, where I think of the journey we've been on and where we've got to with co-production and using lived experience and carer experience is so vital, because it's the powerful impact of the reality. And that can often break down some of the levels of fear and open up some of the really in-depth talking, and I noticed that we were very fortunate to have you and Andy to come to our exec team to give us the training, to have these discussions, and the power in that of you two working together was incredible, and really, really opened up discussion that when I think in past years, before we did co-production, you didn't see. That's a real difference for us, which is why it's great that we're refreshing what we do and giving it that extra drive. So well done to all of you who've been working on that. It's amazing.
Well, it's really good to hear, and I think that's something myself and Andy have recognised by delivering the training, is that actually it's just giving people permission to talk about these subject matters. And I think what you said was really poignant, is that it affects so many people, and we just aren't always aware. And actually, when we talk about it, we give people permission to talk about their experiences as well. And I think from our lived experience group, which is quite small and in its infancy, but what we do have on there is people who have been bereaved, carers. So we are looking at it across the picture, and certainly part of the Trustwise group. There is a point on our agenda around carers, and actually people who are looking after people, because we think it's so important, and that's part of that discussion too, and not left outside of that discussion. And again, it's that importance of including significant others, and realizing again that we can instill hope in other people. So I'm really, really hopeful that actually some of the recordings, when you get to listen to them, actually do instill hope. And I think sometimes, as even in our professional lives, sometimes if you're working and it's really busy and you're feeling quite overwhelmed, you can feel that you can't make a difference. And I think hearing from people with lived experience who have come out the other side of this, are saying, actually, you just asking me that, or you just sitting with me, made all the difference. And I think for our staff team to hear that is really powerful.
I think as well, the talking phase doesn't stop. As a nurse, that if you have lost somebody and you're still working with the carers, and that relationship is so important, and it's the longer lasting relationship, and it's in those bereavement phases that I see us having an absolutely important role. And there's some of my professional experiences that I've really valued, because it's really changed how I might be as a person, as I might be as a leader. And as you look at sort of the suicide prevention work, the bereavement aspect is so important, and it's even more important to talk. And so the changing the narrative is a really fantastic way of looking at all of those elements. And having the carers involved in the lived experience is really great, because they're giving insight that we just may not necessarily have.
Yeah, and the exec board are doing some role modelling around that, aren't they? So I think from a promotion point of view and that team's backgrounds, what else are you doing as a team to really reach out to staff around changing the narrative?
Yeah, so obviously we are looking at the background. We're attending the day next week. We are linking in with yourself, Lisa, to think about how do we get messages out to the teams. We want to think about how we really work on that aspect of hope, and how we can support that. And there's been lots of different ideas in sort of formation about, well, how can we do that to make a real difference for people and to signify that support. So that's ongoing, and really working with our directorates to think about how do we have that conversation on all levels. And so it will become a part of our executive work on a day-to-day, week-to-week basis, and in making sure that we continue to make that space to talk, and that we do continue further training, and think about how we look after each other to reflect how we would want our teams to be looked after. So I think there's lots going on, and it's really opened up lots of opportunities for that.
Yeah, definitely. And psychological safety is so important. And I think we talked about that at the exec board, didn't we, around actually looking after yourself and recognising actually if you are struggling. So some of the messaging that we've got in our recordings is also about individuals that are listening to it, making sure that you're okay, and actually where are you in your journey, because we all are human beings, with lots of different stressors, and it's so important that as members of staff, that the exec team are role modeling that behaviour of just checking with each other.
Yes.
And I think that's amazing going forward, because that's what we want our staff teams to do, and not just clinical teams, I think, is the messaging. So, absolutely, this touches everybody. We want everybody to be looking after each other and thinking about it and making sure that everybody's okay going forward. And part of that is really thinking about a pledge. So on the end of all our recordings, we ask two things really. We say, if you're interested in the training, that you're able to access the Zero Suicide Alliance training, which is a 20-minute training package. It has been co-produced. It's free. Yeah. It's excellent resource.
Powerful stuff.
And you're able to access that on zerosuicidealliance.com/training. As you can see on our backgrounds, we actually have QR codes that you can click on and access the training. And we're really encouraging staff to take the time to do that, because we think it will empower you. But actually, it's really, really good training. And I think as well, we're asking staff and people listening to recordings to just think about how they can change the narrative, whether that's personally or professionally. How are you going to keep those conversations going? And when me and Andy do our training, we always say at the end, actually have a think about, have you got somebody that that's perhaps going through a really difficult time you haven't heard of? Why don't you reach out to them? That could be your pledge for the week.
Yes.
Or actually perhaps you reaching out for help. Or alternatively, having those conversations with your colleagues. Keep that conversation going, because that's going to be the change that we want to see in NHT going forward.
And I think that's where it's keeping it on the agenda, isn't it? And reminding us. We talk about wellbeing, but just that extra bit of reminder. I know yesterday after we had the training, it made me think about, actually, I'm going to reach out to this person. That's what I'm going to do for today. But by keeping that discussion within our exec team about how we keep the narrative going, that will bring more moments of people thinking, this is the thing I'm going to do. This is the thing that feels the right thing to do. And that's what we want to encourage in our teams.
Definitely. Thanks ever so much for talking to me today, Anne.
That's okay.
Thank you for listening to the recording. If you've been impacted by anything that you've heard, please reach out for help. There are people you can talk to. In Northamptonshire, we have a 24-hour mental health number that you can ring on 0800 448 0828. Alternatively, you can ring 111 and press 2 for the mental health option. If you want to talk to somebody, you're able to speak to the Samaritans on a 24-hour basis, and their number is 116 123. If you don't want to speak to someone on the phone and prefer to text somebody, you're able to use the National Shout service, and that number is text 85258. In Northamptonshire, we have a bereavement support service for anyone who's bereaved by suicide called Kelly's Heroes, and you're able to contact them if you want to talk to somebody about your bereavement and you feel you've been impacted on 0800 0025 400. There are also extensive information online that you're able to look up and email them. You're also able to contact survivors of bereavement by suicide, which is a peer support group. You're able to ring them and find out where their nearest group is in Northamptonshire, where you can meet fellow people that have had the same experience of you and get some peer support. Also, we would encourage you to use your social networks and your friends and families and colleagues. It's really important that you may not need to talk to a professional, but you are able to talk to them about how you're feeling and the impact this recording has had on you.